Hi everybody. Today, let's shed some light on an often overlooked challenge that faces many individuals with disabilities within medical settings. Okay, and this isn't just a description of it either. It is a journey or a way of going towards recognition, dignity, and fairness. Now, we've talked about ableism before, but this time we're talking about medical gaslighting. Right? Now, medical gaslighting and ableism they're related concepts, but they're definitely not the same. And gaslighting occurs when healthcare professionals, doctors, nurses, those kind of types of people, specialists and everything, when they invalidate or they ignore your concerns or symptoms. And ableism is discrimination against people with disabilities, and that's because these people believe that there is a correct way for bodies and minds to function, so that able-bodied is the only way. And that's the difference between medical gaslighting and ableism. Now, medical gaslighting can be a symptom of ableism, but ableism encompasses broader social biases and includes a discriminatory attitude towards people with disabilities. So, no surprise here. I have experienced medical gaslighting in my lifetime. I have been overweight all of my life. And it seems to be a thing with the women on my mother's side of the family. The men are stick-like. Oh, it's sad. You know, when you look and you go like, okay, there's my uncle, he's regular weight. There's, my cousin, he's regular weight. Then you go and you look at all of the women, all of the girls. And by the time you reach puberty, right, you're already very fulsome. Now, that of course is great when gravity is working in your favor, but as you get older and it doesn't anymore, it kind of changes things. But anyway, I'm guessing that the doctors didn't think that I knew that I was overweight, because from the time I started to go to the doctor with complaints of various things, right, I was told that I needed to lose weight in order to get rid of whatever it was that was wrong with me. Now, I do know as well that losing weight can help with a great deal of the medical concerns. Would it be easier on my body with the arthritis that I have? Yes. If I lost some weight, you betcha. Would it help with the high blood pressure that I have? Yes, it would. Okay, there's no doubt about that. But in trying to get help for, say, for example, the pain that is associated with arthritis, and I have 3 different kinds, and my inability to walk without aid of a walker and not walk very far, and the spondylitis in my back, I'm not going there to talk about my weight. I'm going there to talk about something to get rid of pain so that I can address the weight. And that is where it gets to be medical gaslighting, because they disregard all of that. And they tell me that I need to lose weight. As a matter of fact, even when I was going to my GP here, this is after my workplace accident, okay, where I fell on a concrete floor on my hands and knees. And that hurt, let me tell you. I ended up with pain all the time. My arm swelled up, and I ended up getting this here. Can you see that there? That lovely up there. Oh, by the way, that's classed as fat, and it most likely is as well. But my job was needing to be fairly limber and doing lifting and those kinds of things. And by the end of the day, when I would finish, my body would be swollen up from doing all of this. My knees, my legs, and my back were in pain. I had Charlie horses in both legs. And my arm, I couldn't move it properly. Like, my hand wouldn't work the way it was supposed to. And it got worse when they switched me to a job where I was still for most of the day. So that was, it's standing in one place kind of thing. So it took a few years, and then I was finally sent for x-rays because I complained enough. X-rays and an MRI. And they discovered that I had severe degenerative arthritis, that I had spondylitis in my back, ankylosing spondylitis, lots of fun in 2 different spots. And in my arm as well, that I would need to have my knees replaced at some point in time, if that was the way it was going to go, because it was basically bone on bone. They were, concerned. And then when the swelling started with the rash all over my legs and on my feet, there was no comment like that other than to say that, yes, when you are heavy for a certain length of time, that's the way that things get. And my doctor told me that I would have to learn to live with the pain, seeing as I didn't want to take his advice and lose weight. Now, my accident was in 2009, and I have been getting progressively worse as time goes by. And I now take and buy my own extra strength Tylenol in order to deal with the pain and the swelling, so I can get by in the daytime. And I stay away from doctors as much as possible, because that is their only solution. Every time I walk in there, it is the same thing. And whereas I will advocate for myself, if it's doing me no good, why am I going there? I just go in to get my prescriptions refilled, and I deal with it from there. It seems like women are put through this kind of treatment more than men do, although men do receive it. Now, a friend of mine, a woman, has been dealing with uncontrolled high blood pressure for literally decades. Okay, she was prescribed blood pressure medication and a diuretic at first, and this was years ago, right, when she was a young woman. And then the medication was changed each time it didn't do what it was supposed to do, in order to try and get a better result. Okay, none of that ever happened. And then all of a sudden the questions started to change, and she went to see varying doctors. They sent her to specialists and stuff. But the questions were all about, what was her diet like? How much did she drink? And was there any anxiety in her life? Were there things that she was worried about? That maybe it would be a good idea for her to speak to a dietitian and a therapist in order to try and maybe fix a little bit more of this issue with high blood pressure. And she and I both agreed that they couldn't find an answer. And so they wanted to put it into some other aspect of things. Because after years of this, so into her 40s and 50s, right? So late 40s, early 50s. And she began to have these episodes, which I don't know how you want to describe them. They were described as TIAs, trans ischemic attacks. And some of them were just sort of like anxiety attacks, they called them as well. And where her blood pressure would shoot up very, very dangerously high, into the 200s over the 190s, and then it would plummet down to 115 over 80 was the lowest it got, but that's a big drop kind of thing. And she would be shaking, and she would have garbled speech. The words were just like that kind of garbling, right? And when you were talking to her, even when the paramedics who were there were trying to speak to her and stuff, she would have trouble processing what was being said. She'd get it eventually, or you'd say it to her a few times, and stuff, or say it to her in some other method, and stuff, and she'd start to get it, and she'd answer. She couldn't walk. There were varying things like that. That went on. She spent a lot of time going back and forth to the hospital, and at times, after a while, the emergency staff would put her into a room on her own on the emergency floor and just let her be there and not deal with her at all. As a matter of fact, when I went there to be with her and she had a spike in her blood pressure, then I called for the nurses. And then when they came in, finally one nurse came in, and then another one came in, and then the doctor after that. They said that they could monitor everything from the desk and that she was in absolutely no danger because they were doing it from out there, which was not comforting, and I didn't care for it very much. And the doctor asked her again in my presence if she was anxious about anything. I just remember the look on her face when she heard that. And then it turned out after some blood work that she had a heart attack, so they said. And they were going to have to send her to another hospital in order to have more tests done. All right. So long story short, she ended up taking, and still does, 5 blood pressure medications. She's had a stent put in because she had 2 major heart attacks. One while she was being tested because they found out that half of her heart was blocked. And then the other heart attack that she had was while she was on the table. They were going to do what was considered then a triple bypass, but she had the heart attack, so they jacked a stent in there right away. And she's been dealing with that since that time. She's had 2 other cardiac incidents since then, and several of these other attacks. So the blood pressure is still not under control. And there are all kinds of medications that come to her every month. And she is in pain, but she would rather go with what she's got because at least she's maintaining than try to get anybody to try and understand her or even want to understand her. It's been a long process, and I think that is what medical gaslighting can do. It makes you feel like you're not imagining things, but like you're not worth the effort, like to them, to all of these doctors and nurses and specialists and things. You're just not worth it to them. That's what I think that it does to you. And so my friend now has high blood pressure. She has mobility issues, and she has some cognitive issues as well. And she is still taking heart medication and blood thinners, and will be on them for the rest of her life. and they said it was anxiety. So the tips I want to give you are not things that are going to end medical gaslighting, because that, I think, is not something that any one person can take on their own. But what I would like to hope that it does is give you some hope, some power, some control back in your life that you can get back. If you go ahead and you take some of this advice, or all of it, depending, and use it when you're dealing with your healthcare professionals. And I think probably one of the most important things that you can do is spend the time before your appointment, right, thinking about and writing down what you want to talk about, okay? It's like, so, all right, say, for example, you're going in and you're going to talk about, in my case, I would talk about the pain I am experiencing in my feet, okay? And it isn't just when I'm standing. I could be sitting down and I get electrical shocks coming up through the bottom of my feet, and I get, you know what you feel like when you have blisters, right? And I feel like I have blisters all over the bottom of my feet when they're just sitting on the floor like this. I can feel this, like it's rubbing, and stuff. And then with the swelling, I feel like I'm off kilter, so kind of thing. But yet, if I said to you, I can't feel my feet. Okay, these are things that I would want to discuss when I went in to talk about this particular issue. Right? So I want to know about these. I want to take the time to go ahead and start exploring and looking at any of the possibilities that I think it could be. You know, like, well, all right, so could it be excess fluid? Could I seriously be just too heavy, and this is what's causing it? Is there such a thing as athlete's foot that does this? I say that because I did think it at one point. So any of this stuff, and write it down, look it up, Google. If you've got a computer, Google's a great source to go ahead and go looking for things. But there's also going to the library and looking up in the medical books there, or on the computers there if you really want to, any of that kind of thing. And if you have friends that you can talk to and that you trust, that might be able to give you some ideas, help you look, all that sort of thing, and write it down and get your questions together. You know, like, what do you want to know? Because this, when you walk in that room, something, I don't know if it does for you, it does for me. When you walk in that room, there's this automatic thing that happens because you're there for you, okay? And it's intimidating because you want to know what's wrong with you, and then in a way you don't, because there's the part of you that thinks it could be something not so wonderful. And so the more you have prepared yourself for all of the things that you think it could be, and the more in control you're going to be, the more focused you can stay, and you can actually hear words that are being said to you. It also will let the doctor know that you are informed about your health and you're proactive in taking care of it. Another thing that would be a good idea to do is to familiarize yourself with your rights as a patient. Most of the time when you walk into, now here we go to the hospital to have appointments most of the time because there aren't enough doctors here. But in your doctor's office, I think there should be a patient's rights brochure on the wall. And these usually will tell you that you have the right to informed consent, and the right to receive information about your condition and treatment options in a way you can understand. This is especially important for people with disabilities, in that people who have cognitive issues, people who are in severe pain, chronic pain, people who, I suppose, you would consider being at end of life, all have the right to know where they stand, what treatment options are available to them, all of them. And to be told what's going on in a language that makes sense. It's great to sound educated and lay out every Latin word you've ever heard, as far as medical jargon goes, and what sorts of tests you've had and how it falls in the high range of whatever it does. And I can give you one of those as well. I went to a teleconference appointment with a rheumatologist, and in the room with me was a representative from the Arthritis Society, because they had rigged this whole thing up, and the Arthritis Society is acting as go-between. And so she would be the person that was doing the looking of the things and relaying information to the doctor. Okay. All right. So at one point in time, they were reading off numbers to each other. And now you have to understand here that the doctor hasn't even said hello to me, but they're reading off numbers back and forth. And they decide that one of the numbers is not so good. I have chronic gout, and so my uric acid level was 611, something along those lines, and they were chatting, and I said, "Excuse me, but is that high?" Right? Because what do I know? Okay. And the doctor stopped for just a second and said, "Well, I think so." That was the extent of it. And so then I got put on medication. And I said, "So how long will I be on this medication? Like, am I going to be on this for the rest of my life? Like, what's the story? What's normal? How, and the answer that I got was, "We'll have to see." So that you cannot make decisions based on that. It's impossible. So you have a right to have more than that. Don't forget to be brave enough to remind your doctor that there is a patient's right document in effect, and it guarantees you respectful, non-discriminatory care. That should give you a feeling of calmness, knowing that this exists. One of the things that I also think is important is recognizing that when you go into a doctor's office for yourself, when you're going to see a specialist, when you're going for one of those wiki tests, the first time and the only time I've been for an MRI once in my life, okay, and I'm like, what is going to happen. And I did speak to a great number of people before I went so that I would know what to expect when I got there. Remind me at some point in time to tell you the story. But if you can possibly do it, bring someone that you trust with you to your appointments. They should be someone that knows you and your medical history, and they should also know that you have been dismissed or gaslit, right? So somebody that you talk to regularly and you trust. Now, you need to choose somebody that you know is going to have your back, okay? That they're going to take your concerns and advocate on your behalf, be your moral support, and ensure that your concerns are taken seriously by your healthcare provider, but they're not going to try and take over your side of the discussion. Okay? They're there to support you. It can be hard sometimes because friends really want to do good things. And when they see that you are upset or that you're struggling with it, they may want to jump right in, and they have to know that this is not what you want, that you want them to help you get to that place where you are doing the talking. You also have to make it clear to the whole team that's in the room that you are the person that is making the decisions, and you are the person that they should be talking to, and not the person who is there as your support person. Right? It happens to a lot of elderly people. They will talk, if they come in with their children or the PSW, or the conversation shifts, and the doctors or the specialists are no longer speaking to the person that is there because they're older and they're a little bit slower maybe in absorbing things, or they ask too many questions, so they just shift over, carry on, and that too is being gaslit because you're being ignored. And so the person who is with you has to understand they talk to you, they don't talk to that person that you're with, and that your support person can redirect them back to you. It's a really good thing to get into. Now, another thing that they tell you all the time when you're working, and it pays off here too, is to document everything. Document your symptoms, how long you've had them, how intense they are. If there's something that you notice that brings on, like for me, sunlight. So it's a rash, what can I say? How it affects your life, and you want to know the dates and the details of all of your medical appointments, like what was discussed, how did things go, what sorts of determinations were made. This is your sort of version of your medical record, so that you can use it when you are dealing with your healthcare professionals. It's a big one. It's bothersome. Sometimes what you can do, if you carry a cell phone, there are all sorts of recording apps, and just turn it on so that you know what's going on. And there should be absolutely no healthcare professional out there that, if they're worth their salt, should worry about that sort of thing, because they are only supposed to be giving you the best quality care that they can. The most important thing to remember no matter what is happening, no matter what you decide to do or don't do, is that all of this is about you, your body, and what will work best for you. You need to start believing that you are worth the effort, and don't let anyone tell you differently. Thank you for watching. We'll see you in the next one.